Hey y'all, my name is Rohit Verghese, and this will be the QBank remediation for week 7. And so this week I have another set of 3 questions that I want to go over, which I got incorrect when I was doing my Kaplan questions. And so the first question that we'll go over is about prioritization. And so the question asks, the nurse provides care for clients in the emergency department. Which client does the nurse assess first? So now I'll go through the answer choices. Number 1 was a client reporting a dry cough for several weeks with frequent night sweats. Number 2 was a client reporting vaginal spotting and that the last menstrual period was 2 weeks ago. Number 3 was a client reporting right upper quadrant abdominal pain with nausea and vomiting. And number 4 was a client reporting burning epigastric pain that radiates to the mid-chest when lying flat. Now, I picked that last answer choice number 4, but this is incorrect because the client is most likely experiencing acid reflux. So we should instruct the client to keep the head of the bed elevated and possibly offer them a medical intervention if needed. The correct answer choice was answer choice number 1, a client reporting a dry cough for several weeks with frequent night sweats. Now, these are classic symptoms of tuberculosis. So, placing the client in an airborne infection isolation room or some other type of room with an appropriate mask to prevent spread of the disease is the correct answer until the evaluation confirms the diagnosis of TB. And so that's why answer choice number 1 is correct over answer choice number 4. Moving on to the next question. This is a select all that apply question. The nurse provides care for pediatric clients on an infectious disease unit. The nurse understands appropriate transmission-based precautions are in place for which client. And so this is a SATA question. And so there were 6 answer choices. Number 1 said a school-aged child with rubella or red measles who is in a private room with the door left open. Number 2 was a preschooler with varicella who shares a room with another preschooler with varicella. Answer choice number 3 was an adolescent with H. influenzae type B meningitis who is in a private room with the door closed at all times. Number 4 was an adolescent with hepatitis A whose nurse wears an N95 mask while in the room. Answer choice number 5 was an infant with rotavirus whose nurse wears a gown and non-sterile gloves while providing care. And the last answer choice, number 6, said a preschooler with group A Streptococcus pneumoniae whose parent does not wear a mask when holding the child. And so there were 2 correct answer choices that were present within these choices, but I picked only one of them, actually. And so the one that I picked was answer choice number 5, an infant with rotavirus whose nurse wears a gown and non-sterile gloves while providing care. And so this is correct because rotavirus is a GI infection that causes acute diarrhea. It requires contact precautions, including a gown and non-sterile gloves, for any contact with the client's skin or with inanimate objects that may be contaminated. The second answer choice that was correct was number 2, a preschooler with varicella who shares a room with another preschooler with varicella. Now, this is correct because varicella, or chickenpox, is a highly contagious disease and requires airborne precautions. But 2 clients with the same airborne disease but no other infection may share a room because they both have chickenpox. So they're already infected, so they can't infect each other again, And so that's why answer choices number 2 and number 5 are correct. Moving on to the last question. And so this is not a stated question, it's a normal question. The answer reads as follows. The nurse has completed the admission history for a child with acute lymphocytic leukemia undergoing chemotherapy. The client's sibling was diagnosed with chickenpox today. After developing a rash last evening, which action does the nurse take next? Now, the answer choice that I picked was answer choice number 2, which is to institute contact and droplet precautions. And so this is incorrect because airborne and contact precautions are needed for varicella and are implemented for non-immune clients who have experienced varicella exposure. The correct answer is answer choice number 3. Administer varicella immunoglobulin to the client. And now this is correct because the varicella zoster immunoglobulin administered to immunocompromised clients can prevent the development of varicella infection. So since this patient is immunocompromised, giving them the varicella zoster vaccine would be the best idea in order to prevent the development of varicella. And with that, that was the 3 questions I wanted to talk about for this week. Thank you.